Research has shown that a third of people who die by suicide had a healthcare visit in the month before their death. Experts in Maine's largest healthcare system say it's a key opportunity to intervene.
Utilizing a $2 million federal grant, Maine Behavioral Healthcare is training doctors system-wide to better serve patients struggling with mental health through the Zero Suicide Initiative. News Center Maine's Vivian Lee shows us more.
Last month, the U.S. Centers for Disease Control report found the number of suicides nationwide hit a record high last year. Maine's suicide rate dropped from a little more than 19 per 100,000 in 2021 to more than 17 per 100,000 in 2022. But it is still the second highest rate in New England.
If you do everything right, you will decrease suicides.
Dr. Linda Durst is the Chief Medical Officer of Maine Behavioral Healthcare and heads up the Department of Psychiatry at Maine Medical Center. MBH adopted the National Zero Suicide Initiative 3 years ago, rooted in the belief that suicide deaths in patients under the care of a healthcare system are preventable.
People who've died by suicide, 40% of them were seen by a primary care provider within a month of their death.
MBH is using a 5-year, $2 million federal grant to train providers from primary care physicians, specialists to emergency room staff system-wide in 8 counties to better screen patients 18 and older for risk of suicide and connect them with treatment and resources if the risk is high. Dr. Harold Van Lonkhuizen is a psychiatrist and regional medical director for MBH and sees patients in the Mid-Coast area. He says the initiative will help give patients who are struggling with mental health issues more access to intervention.
We can focus on the patients who are higher risk, who really need that and can benefit from that. So it helps to make the process more efficient.
This ornament here.
Angela Witten lost her 18-year-old son, Trent Gibson, to suicide in 2022. The Wells resident first put up a Christmas tree to honor her son during the holiday season. Now there are 7 Trent's trees from Kittery to Millinocket that people can adorn with ornaments to remember loved ones lost to suicide. She also started the nonprofit Stay for Life to raise awareness about mental health among boys and men specifically. Angela feels the Zero Suicide Initiative is critical, especially in rural areas.
It feels hopeful for people that do need more help than they know how to receive at this point in time.
Now, the Zero Suicide Framework was developed by a healthcare system in Michigan 2 decades ago, and it has led to a nearly 80% reduction in deaths by suicide among its patient population. Dr. Durst says, meanwhile, the Zero Suicide Framework will serve about 12,000 patients a year.
That's our goal, is to really be able to dramatically drop the rates like that.
And even more potential to save lives. In South Portland, Vivian Lee, News Center, Maine.
Now, there are several resources available to people who are in crisis or emotional distress that are free and confidential. That includes the Maine Crisis Line. You can see it right here, 1-888-568-1112. You can also dial 711, as well as the Suicide and Crisis Lifeline at 988.